In 2001, Catherine Patton was diagnosed with type 1 diabetes during her pregnancy and was told by her doctor she would need to take multiple daily insulin injections. Tired of repeated needle sticks, she invented the iPort, a medical device that eliminates the need to puncture the skin for each diabetes shot. Catherine represents patient innovators who are developers of solutions to their own medical problems. Patient Innovation, a leading platform in Europe for innovative user-developed solutions in healthcare, was instrumental in sharing, receiving feedback, and promoting the iPort solution. This platform facilitates the sharing of patient innovations, enabling ideation, experimentation, and validation of solutions. Through such activities, patient innovation empowers the community of patients to innovate along with incumbents, connecting them to the resources and networks required to commercialize promising solutions. Multisided platforms are new organizing forms that can boost innovation in the healthcare sector by empowering patients as innovators and facilitating the commercialization of innovations by and for patients. However, applying the playbook script for the platform model from other sectors may prove challenging given the distinctive nature of the healthcare services. There are three main roles: community organizer, market matchmaker, and innovation manager, along with corresponding orchestration activities that the platform performs to boost patient innovation. The community organizer creates a safe venue for sharing innovations developed by patients and informal caregivers, boosts their innovation potential, and coordinates activities to enhance their impact. With a market matchmaker, the platform acts as an intermediary, connecting innovators with producers with the relative resources and manufacturing capabilities that are interested in bringing the innovations to the market. The innovation manager brings together all the actors involved in the innovation process to internalize innovation externalities and coordinate innovation activities such that complementarities from cooperation can emerge. Rather than matching users across sides, as in traditional multi-sided platforms, the platform must manage its patient user community to enable the generation of innovations, development of functional prototypes, and diffusion of innovations. At the same time, it must bring together multiple off-platform actors from the traditional healthcare value network, such as doctors, manufacturers, research labs, and regulators, to enable the commercialization of such innovations. To learn more, please read Unlocking Innovation in Healthcare: The Case of the Patient Innovation Platform by Carmelo, Cennamo, and others in California Management Review, Volume 64, Issue 4.